Okay, we're making some progress. We've talked about the C, the cell health. We've talked about the F, the functional movement. Now let's talk about the A in the C.F.A.N model, which is articulation. So articulation is why most people come to see us as providers. It's why most patients are interested in what we do, because the articulation is what's giving them problems. They get the MRI, their X-ray, it says you've got bone-on-bone arthritis. Your knees are worn out. It's time for a knee replacement. Let's try some cortisone shots. We all know there's better options out there, that surgery is never the first option, and that the science behind prolotherapy, PRP, and now stem cells is very strong for articular cartilage. So that is why patients come to see us, is because the A of the C.F.A.N model. So if we talk about the A, articulation, we talk about what's inside the joint. So we have hyaline cartilage, which is that, that glossy stuff that's on a chicken bone. You're eating your drumstick, you look at it, that real slippery kind of glossy white stuff, that's hyaline cartilage, and you want a lot of it. Hyaline cartilage is there to help to kind of smooth out the joint. It's what is there when we're young, and as we age and we get arthritis, that hyaline cartilage gets ground away because of the functional movement when there's instability, right? The other thing that you'll find in the joints are menisci. So the meniscus in the knee is there. They're kind of like little cartilage buffers. They act to guide the movement. They're shock absorbers. They're very important, but that can also rip and tear, causing pain. When they rip and tear, they're no longer as stable. That can lead to more degeneration as well. So meniscus are things that we need to treat when we're treating things inside the joint for their articulation. Other things that we treat are kind of like the meniscus, but in the shoulder there's something called the labrum. The labrum is a ring of cartilage that kind of is like a suction cup that holds the ball and socket together, gives us some stability and guides the movement as well. There's other small places like in our wrist we have something called a TFCC. If you fall on an outstretched hand, you can tear that piece of cartilage, which is part of the articulation. So when we're talking about the articulation, it gets all the attention. It's very important to treat, and there's some amazing things we can do to treat that with prolotherapy, PRP, and stem cells. But again, we need to look at the C, the F, and the N of the C.F.A.N model to get optimal healing.